Okay, so our ethical dilemma is called Veneers, A Costly Alternative by Melissa Rocha, Giselle Sandoval, Daisy Nahera, Angelica Ibarra Leon. And our case scenario was Amanda, a 22-year-old female patient, comes into the office for a first-time visit. She is new to the office because she just moved to California from out of state. She says that she does not visit the dentist regularly because she doesn't understand the need to go, unless it is because she's feeling pain. The patient presented with heavy plaque and heavy staining due to being an avid coffee drinker, inflamed gums, and a high BOP of 48%. Her radiographs indicates that she has 5 carious lesions on the anteriors of 7, 8, 9, 24, and 27, as well as very moderate subgingival calculus. The patient mentions that she is set on getting a complete set of veneers in hopes of fitting in with social media influencer culture. She has high hopes of making it big one day, and now that she is living closer to Los Angeles, she feels the veneers are the next step. When the dentist came in to do her DDS exam, Amanda mentioned her interest in veneers. She supported Amanda's ideas without asking any questions. So that's our case scenario. And there's lots of pros and cons to getting veneers. So some of the pros that we have to getting veneers are they require just a few dental visits. The porcelain material used looks like real teeth. Veneers are used to improve the shape and contour of the teeth. Another pro is they do not stain, thus teeth whitening will not be needed. So that's a pro. You don't have to ever whiten your teeth. If you get them white, that's how they are forever. Well, for as long as you have the veneers. The veneers can replace damaged enamel, which include enamel abrasion or erosion. And another pro is they're also very cosmetically appealing. So they look really nice if they're done right. Some of the cons to the veneers are they are not reversible. There's not adequate patients that have, they're not adequate for patients that have periodontal disease. Veneers are very costly. The average cost can range anywhere from $900 to $1,200 per tooth. And if a veneer was ever chipped or cracked, it usually cannot be fixed. It would just have to be completely replaced. Patients that grind their teeth are not good candidates for veneers because they're so thin. And natural teeth may become more sensitive to hot and cold temperatures due to the lack of the enamel because they have to shave down their actual natural teeth. They may not exactly match the color of their other teeth. And if a patient is planning on whitening their teeth, that needs to be done before actually getting the veneers, because the veneers, you can't change that color after. And if a tooth were to get decay with the veneers, then you might have to just replace you'll have to get a crown.
So by using the 6-step decision-making model, step 1, identify the ethical dilemma or problem. So summarized, a young female patient came for her first visit at the dental office and presented with poor oral health. She had heavy plaque, staining, subgingival calculus, inflamed gums, along with an uncontrolled BOP and decay. Her main concern was the appearance of her smile. So she was determined to get veneers. The dentist dismissed the state of her oral conditions and agreed to arrange treatment for a full set of veneers. The ethical dilemma here is whether the hygienist should step in and explain why isn't the best option for her right now, or if she should respect the patient's desires and the dentist's decision. Step 2 is collect information. So through this, we would ask questions. Why does the patient want veneers? Does she have complications with her natural teeth? Has the patient looked into the process, cost, or side effects? How well is this patient informed? Are there any treatment options that can improve the cosmetic appearance of the patient? Does the dentist plan on addressing her oral health? What does the patient know about OHI? Is this procedure going to be performed soon or further down the line after her oral health has improved? Step 3, state the options. So we have option A, do nothing and let the patient proceed with a full set of veneers. Option B, educate the patient again and use visual aids to help improve oral health and its connection to improvement in her smile. Option C, talk to the dentist and express our concerns. Or option D, report the dentist.
Okay, and step 4 is apply the ethical principles. We have non-maleficence, beneficence, veracity, autonomy, justice, informed consent, paternalism, and malpractice, which is the negligence. So the non-maleficence is the dentist and the dental hygienist need to first treat the overall oral health of the patient by properly diagnosing the patient for restorative work as well as a cleaning. The patient can begin to restore the oral health. Due to the patient's decay, the natural structure of the tooth has been hindered. The placement of veneers when the tooth is compromised can lead to failure of the porcelain veneer to adhere and can later fall off. Proceeding with cosmetic treatment can create additional complications and lead to complete loss of the teeth involved due to irreversibility of veneers. This would now lead to the patient needing an extraction or crown of the tooth that could have been treated and saved with restorative work. Beneficence is compromised because doing good requires all appropriate actions to be taken by the clinician to help restore the patient to an overall healthy oral state. Malpractice, which is the negligence and substandard care, is a legal issue to consider in this case because the dentist is failing to diagnose and create a plan with the patient's current oral conditions in mind. It is unknown if the dentist is specialized in cosmetic dentistry. Therefore, substandard care would also be an issue. We also have veracity and informed consent. So the dentist sees this opportunity as a financial profit and disregards the patient's oral health. The dentist needs to be truthful and discuss the state of the patient's oral health and why she is not a good candidate for veneers. The patient first needs to be educated on etiological factors that are causing her problem. Current decay and lack of OHI are a causative factor aiding in the decline of her oral health care. Also, the dentist has an obligation to inform the patient about the damage veneers cause, such as weakening the tooth structure, removing enamel that can lead to sensitivity, gum tissue, takes an additional time to respond well to the placement of veneers. Once informed, the patient must understand and proceed to make an educational decision.
Okay, so then we also have autonomy, justice, and paternalism. The patient is entitled to make their own decision on treatment. By the dentist omitting the valuable information, the patient is not capable of doing so. However, it is also the clinician's responsibility to practice beneficence and paternalism to make the best decision for the patient. The patient needs to understand how the procedure can lead to additional damage. The patient is entitled to a fair, adequate treatment that will not have harmful side effects. Treatment should be patient-oriented to fit their individual needs rather than for a financial profit. So step 5 is make a decision. So these are some of the examples we have. So tell Amanda, the patient, and the dentist to hold off on scheduling treatment day for veneers. Create a treatment plan for SRPs that includes stain removal. Come to mutual understanding to make it a goal to improve her oral health. Provide different options that won't change the anatomical shape of the teeth. Explain to her how a crown will be a better outcome and incorporate whitening to give her that white smile that she is looking for. So step 6 is implement the decision. To implement the decision, the hygienist will talk to the dentist in front of the patient. Together, they will formulate a treatment plan focused on the patient's needs first and provide as much information so that the patient will fully understand the importance of oral health. After the patient's health has been improved, this will have also improved the overall appearance. We can later look into other options if cosmetic appearance is still something that the patient is concerned about. And that's our case scenario.